what's called board certified, meaning we have to take tests for radiation oncology. It's a written test, and then if we pass the written tests regarding patient care and physics and radiobiology, aspects of patient care following residency, then we have to go take an oral test. So we have to fly to, it happens to be Louisville, Kentucky right now, where we go and get basically quizzed by colleagues that are certified to give the test, to make sure that we know what we're doing and that we're safe to treat patients and to ultimately have that stamp of approval, board certification. And in today's world now, all that board certification expires on a 10-year rotating cycle. So every 10 years we have to retake a test. So I just did mine actually about a year and a half ago, successfully, thankfully, but stressful nonetheless.
How was that?
Well, basically because I am able to treat all sorts of patients, but there's some types of patients that I don't treat. I don't treat children with radiation therapy. Well, just because I don't treat children with radiation therapy doesn't mean that I didn't need to answer all those questions on the test. So it was very stressful to try and get back up to date on things that maybe I don't usually read because they're not applicable to my day-to-day practice, because I don't see that patient population. But it's called maintenance of certification, and it involves looking at our own chart reviews, doing self-assessment modules where we have to gather information or watch particular programs on like a web presentation, and then answer questions, take a test, make sure that you're doing and learning what you need to learn. So it's a pretty intense process that helps to ensure that docs are staying up to date. Because natural tendency is that you're not going to do all of that structure unless you're required to do it. And so that's called maintenance of certification, and all of us go through that.